Can you picture the alliance between health information professionals and public health professionals? As a healthcare professional with an interest in both camps, let me introduce you to one side of the story. I'm Clarice Warner, and I represent the Ohio Health Information Management Association Executive Board as a Director of Advocacy and Delegate. This year was another adventure at the 74th AHIMA House of Delegates meeting held on October 17th. We were supposed to be in Atlanta. Oh, how I miss traveling. Due to our current state, we had an all-day virtual meeting from 12 noon until 6 p.m. And as fate would have it, it went over by almost an hour. We had a jam-packed agenda that detailed past, present, and future advocacy initiatives. One of the highlights of the meeting was the Strategic Pathfinders sessions. In these sessions, delegates were asked to react to assumptions on the future of health information topics and help inform AHIMA's future through management of health information. The 6 session topics were as follows: taking the lead in data governance, the future of patient identification and matching, the role of health information professional in shaping health equity, public health, ethics, and health information, revenue cycle challenges for health information, and telehealth in the future. Can you guess which one I attended? If you guessed public health ethics and health information, you are correct. Let me take you inside the session. Why is public health important to health information in the future? First, I would actually add, and the present. This was the rationale of our topic. According to the July 16th article, Electronic Public Health Reporting Now Available in the Journal of AHIMA, the author states public health reporting varies by state and is dependent upon the healthcare provider's timely and accurate reporting. We are witnessing wide gaps in reporting during the pandemic, due in part to the continued use of paper-based systems. This manual approach of individually faxing, emailing, and making phone calls to public health agencies is time-consuming, error-prone, and inefficient. And it reduces the epidemiologist's ability to investigate potential cases in a timely manner. Health information professionals are data stewards who support public health reporting by governing the collection, management, protection, and sharing of quality health information. We serve as a bridge between clinical documentation and the accuracy of reported data. Health information leadership's evaluation of current public health reporting workflows in their facilities is crucial. Moving from a paper-based reporting system to an electronic one should be prioritized to ensure community and state leaders have the timely, reliable information they need to make good decisions. We started our session with a poll question. How can health information professionals impact the accuracy of public health reporting during the pandemic? There are 2 hypotheses. The first one is, if public health data is reported accurately, the COVID-19 data will be valid and trustworthy, which will allow federal, state, and local health officials to safely and appropriately make decisions on opening businesses, schools, etc. The other hypothesis is, if public health data is not reported accurately, the COVID-19 data will be invalid and untrustworthy, which will inhibit federal, state, and local health officials from safely and appropriately making decisions on opening businesses, schools, etc. The discussion centered around which hypothesis are we seeing as most likely and why. 17 of the delegates voted for number 1 and 12 voted for number 2. We also had several questions to discuss, and one of the questions posed was, what can health information professionals be doing now for public health and ethics and health information? Educate, educate, educate. We need to take advantages of the opportunities to educate the general public through PSAs, conversations, etc., on the processes in place to ensure data is accurate to further build the trust in the profession. Another commenter said, continue to advocate for the integrity and accuracy of health information management. So the resounding takeaway from the delegates was educate, advocate, and policy implementation. So let me ask, what do you think the health information professional can do now for public health, ethics, and health information? You can place your thoughts below in the comments. Overall, this was a great session. All of the delegates were engaged and participated. As a result of some of our efforts, AHIMA recently published a policy statement on public health. AHIMA supports the use of policy to ensure the soundest, most reliable, and responsible use of health information for public health. There are 5 areas that the policy must embrace. Number 1, encourage standards to ensure accurate and timely data are used for public health. So as we move through the business of the meeting, it never ceases to amaze me how passionate the delegates are related to the health information profession. And just like that, another House of Delegates meeting is in the books. And as always, it was my pleasure to represent the health information professionals in the state of Ohio.